Believe it or not, I'm going to start off with a quick update on testing and hospitalizations. That will come as no surprise to the folks who are here who spend every morning or every afternoon with us. Yesterday, we conducted and processed about 10,000 tests. That brings the total number of tests we've conducted in Massachusetts to about 324,268 tests. Only 10% of the tests that were completed yesterday came back positive. That's the lowest percentage we've seen since the end of March, when the Commonwealth was testing about 5,000 people a day. We remain focused on continuing to expand our testing capacity and believe it's a good sign that as the testing numbers are getting bigger, the percent of positive cases is getting smaller. It's important to remember that the test results alone are not an accurate depiction of what's happening across the state with respect to COVID-19. The test results are completely dependent on who gets the test, and we've been targeting our tests to certain areas and facilities, long-term care, hotspots, and high-risk parts of the population to make sure that we have a good sense of what's going on in the places where we need the most information the most quickly. Every day we've had conversations with our colleagues in healthcare and in the hospital industry to monitor our healthcare capacity and our hospitalization rate. And as of Sunday, there were 3,539 patients, or about 5% of the cases in Massachusetts that were hospitalized due to COVID-19, which is another drop from the day before. The total number of people hospitalized yesterday dropped by about 78 patients. We've seen a pretty steady downward trend on the number of people hospitalized for COVID-19 for just about a week. That's a really encouraging sign and a key piece of data that we watch closely with respect to almost all issues associated with how we're doing. We're still very much in the fight against the virus, but it's encouraging, I think, for everybody to see progress given how much hard work and how much sacrifice has been invested in this. As we come through the other side of this and start to determine next steps for going forward, we need to see these numbers continue to fall. And that's based on guidance and advisories that we've gotten from this country and, frankly, from many others as well. One of our main priorities continues to remain tracking down more personal protective equipment and getting it out to healthcare facilities and other healthcare providers across the Commonwealth. As of yesterday, we've delivered almost 8.5 million pieces of PPE, including masks and gowns and gloves and ventilators, and we're getting this protective gear out to a variety of places, including hospitals, senior care facilities, long-term care facilities, and of course to our first responders. And in part due to the gracious and inventive work of companies like Mero, who are here with today, who have stepped up, we can help produce PPE right here in Massachusetts. Securing PPE for frontline healthcare workers and public safety personnel has been a challenge, not just for us, but for people across the country. And we continue to work supply chains, but we've looked to our own businesses right here in Massachusetts to help us produce life-saving gear and supplies. Through some unique partnerships, we've created and funded a program called the Massachusetts Emergency Response Team. And this program offers several resources to assist local manufacturers that want to make PPE, even if it's not necessarily in their business model. And companies like Mero are one of Mert's biggest success stories. The team came together through the Executive Office of Housing and Economic Development and the leaders of the state side of the Advanced Manufacturing Collaborative and the Mass Tech Collaborative. Carolyn Kirk, who is the executive director, is standing directly behind me and oversees this program. It includes folks from academia, industry, and government with a shared mission of opening up new sources of products that can be used in the fight against COVID. We established procurement portrait for manufacturing companies to use, and so far we've heard from 667 manufacturers who are looking to help. 424 of those companies are located in Massachusetts, and 34 of them are right here in Bristol County. MERT helps companies identify what types of items are in need, provides regular guidance and assistance, helps coordinate supply chain needs if they need the help, access to testing, reviews product instructions for use, labeling, and packaging, and puts them in touch with the right people if they need to get approvals at either the state or the federal level. And I do want to give a big shout out to the folks at MIT, WPI, and the folks from UMass Lowell, all of whom have provided us with a lot of technical assistance and guidance along the way. I also want to thank Senator Mike Rodrigues for his hard work and dedication here in the district. He was one of the first people to talk to us about Mero, and I also want to thank Representative Silva. Where is he? Sylvia, where is he? They left, okay. Representative Schmidt and Sylvia were both here. Two other folks who've been terrific allies on a number of these initiatives. And I think the main point I want to make is how important it is for us to create supply chains and opportunities to access gear that are closer to home. We all know all the stories that many of us have been involved in, not just here in Massachusetts, but around the country over the course of the past 60 days or so, where we've been busy chasing gear all over the globe. And there are all kinds of interesting and complicated issues that come with chasing supply chains that take you not just outside the Commonwealth, but outside the country. And one of the best parts about this particular initiative and this particular company that we're standing in here today is they're located here in the Commonwealth. They've been working with us for several years. Charlie and I were talking earlier about the fact that we and they have been investing collectively in this facility to help them get into the business of instruments and soft cloth products for quite a while. And it's those investments in many respects that made it possible for them to step this up and set it up in such a quick period of time when the opportunity presented itself to do so. I do believe at some point they will be the largest manufacturer of USA-sourced fabric, thread, and trim PPE medical isolation gowns in the country, which is quite a story for an organization that only decided to get into this business 40 days ago, 50 days ago? 40 days ago. They're also working on surgical caps, gaiters, and pillowcases as well. This is an 8th-generation family business. They know how to pivot. They've done it many, many times over the course of over 100 years. And they're projecting that by the end of this summer, they'll be making 700,000 gowns a week at this facility. This obviously will establish a new, substantial, and very secure supply chain for essential medical products and gear for our healthcare workers right here in the Commonwealth that can support providers here in Massachusetts and in other areas as well. I think the best part about this in some respects is they've been able to hold on to their staff. They've hired about 41 new people, and they believe they could add well over 100 people when they really get to scale. And they'll be doing something that will be unbelievably important to the healthcare provider community here in Massachusetts and across the country. I do also want to say that we're thrilled that they've been able to get together with our colleagues in Rhode Island, with my friend Governor Gina Raimondo down there, and stepped up to help them with an original delivery of 3,000 gowns with 500,000 more on order. And I think in some respects it's a story that speaks to the creativity and collaboration between a terrific, well-known, long-established family business here in the South Coast in Bristol County and a Commonwealth of Mass that look for an opportunity to find partners like this so that we could create the kind of supply chains right here in Massachusetts that could serve our healthcare industry and our people, especially our people. And with that, I'll turn it over to Charlie.
Thank you, Governor Baker. It has been a 40-day exercise of scaling a supply chain for medical products, but it's been a 3-year program of investing in the infrastructure to be able to do it. And I want to thank Governor Baker and his administration. I'd like to thank Carolyn Kirk and Mass Tech. They've been partners for years now. We built a workforce training program that last year put 71 people into full-time jobs in an industry that people had long ago written off. Merrow has been very hopeful and invested in the industry of building soft goods for the last several years in Fall River and New Bedford because we have such remarkable skill and talent in this part of Massachusetts. And I think one of the terrific stories about in what is otherwise a pretty grim time is that the investment that we've made and that other companies have made in Massachusetts are allowing us to lead in the country in the development and the manufacture of PPE. And this is a significant moment where industries that long ago thought that they had been left for dead are now vital. And the investments that are being made in infrastructure, the investments are made in plant and equipment, and our programs to help bring people into the workforce are going to make a difference for Massachusetts for a long time to come. And I maintain that this is an opportunity for Massachusetts to become a leader in an industry that needs leadership. and that we're proud to be part of it. We wouldn't be here without our partnership with the Baker administration and with Mass Tech and with the remarkable people who have worked over the last month to help scale this into what is a significant operation. But there are another group of people that need to be thanked, and that is every person who has come to work in this facility over the last 40 days. It is not easy to come to work in an environment where there is a health crisis that is present, and we have worked very hard to keep everyone safe, and they have been safe. But those people who have worked 18-hour days for the last 40 days are the people who have provided the 15,000 garments that will be shipping off of the dock today, and are building the millions of gowns that are going to be in the state over the next several months. So my gratitude to them, my gratitude for the staff here that have steered something so successfully, and I would look to everyone to recognize that these long-term partnerships, these commitments from the state and the hospital organizations to build product in the U.S. will allow us to have established a durable and reliable long-term supply chain for isolation gowns to be provided to the entire country. And we're grateful for all those partnerships. And thank you, Governor, once again. I appreciate you coming, and we're very proud to be part of this manufacturing exercise. Thank you so much.
The one other thing I just want to say is I had a chance to get a look at 150 years worth of sewing machines that they have in one of the hallways on the way up and down the stairs, and the product has obviously come a really long way over the course of that period of time. But I think it's this family business and Charlie and Owen and the rest of the team's ongoing interest in fabric and design that really makes this possible. Some of the designs that they are working on and some of the ways they're thinking about how you can manufacture these gowns are game changers with respect to their ability to not only supply those gowns to providers in Massachusetts, Rhode Island, and elsewhere around the country, but also establish a sustainable way of doing this that's going to be with us for a long time. And I've said several times that I certainly hope one of the main things that comes out of this whole pandemic is a series of learned lessons. And one of the most important lessons that we need to learn as a country and as a Commonwealth is that it's important to have supply lines and supply chains in key industries that are close by. And I think for us, this is a great example of an opportunity to do just that. And I really want to thank the Merrill family for stepping up. Questions for Charlie or for Carolyn or for me?
Can you be more specific about the local impact of this? How much locally do you see going to the Boston area, Rhode Island, Western Massachusetts?
Well, our order is 2.5 million gowns. So,
Sure. Over the next several months, there will be 3 to 4 million gowns delivered to the Commonwealth and to Rhode Island. We're working closely with a lot of hospitals, coordinating with Mass Tech to make sure that we get things as quickly as possible into the market. But these are long-term relationships, so we'll see. Probably, I would assume by the end of the year, by the end of 2020, we'll have 4 or 5 million products that are in the Commonwealth and Rhode Island.
And does the funding come from the state, the feds, the hospitals, or a mix?
Well, I want to be clear about this too. Our relationship with the administration is as a provider of product, and we have not asked for any money other than the orders that have come through. So we receive purchase orders and we build to those orders, and that's been part of our relationship is to be a manufacturer of record and not require any special type of help.
And the orders come from the state, the feds, the
All over. So the orders are coming in from the state, they're coming in from private hospitals. We get orders from small organizations that require a little bit of product. So I mean, we were talking earlier about what this looks like, and it looks like orders from 5 to orders of 5 million. And we are working very hard to provide all of them.
Talk about the empty coveralls that you just showed me. I mean, this has the potential to branch into a lot of fields.
Yeah, we have a development and design program where we're working on and delivering every week new products. So we have a coverall that is a reusable coverall and a disposable coverall for the first responders. We have a series of gowns that we've built with increasingly technical fabrics for providers, materials that aren't used in the medical industry right now to make a more technical and a better product. We have a lot of feedback coming into Mero from people in the field who are asking for particular types of things, and we're being very responsive to that. So there's an opportunity right now, as the governor says, for this to branch into many, many product categories that are built around a similar supply chain. And I will note that part of that supply chain is a Massachusetts supply chain. A significant amount of the gowns that will be coming into Massachusetts are actually from fabrics that are being developed and built in Massachusetts. So this is very much a Massachusetts manufacturing story.
One of the reasons why you can go to other countries for PPE is costs, labor costs. It costs a lot less to produce it down in China than here. How do you compete with that and paying anybody to live there?
We provide product when the borders close. I think we are. How do we compete? We are a reliable and durable supply chain that will be here regardless of what happens outside of the borders. And there is no question that our product is much more expensive to build than a product that's built in China. What it is available right now to hospitals. And I think that when we revisit and we look at the policies that need to be discussed and implemented after COVID, part of it is going to contemplate how healthcare systems and how states can have a reliable source of essential medical products when there's a disruption at the ports. And I think Mero's role is not to build the least expensive product. It's to build a product that is better than the quality that can be made available otherwise, and here regardless of what's going on outside the ports.
So you see this as being a long-term?
We do, and I think we were talking about it earlier. Many people are generously participating in the building of PPE, and I think that all of them deserve a tremendous amount of recognition. But there's something that's fundamentally different in our approach. We've stood up an entire line of medical products. We put a team together to develop, design, and build them to pass the strictest certification requirements by the FDA, and we consider it a significant investment in a business that will be here for a long time. We also understand, and I think this is something which makes Mero different in our approach. The supply chain isn't just what we have in Fall River. It is the yarn and the fabrics that need to be developed and built. These fabrics are not available in infinite supply, and Mero has consumed many of them, many of the yards that exist. To have a reliable supply chain means that we need to make fabric buys that are 8 and 10 and 12 months out so that we can continue to provide that. There are two different approaches to participating right now. One is to do what can be done today, and the other is to look out ahead and be setting up and building an infrastructure that will be able to deliver products in October and in 2021, and that's what we're doing.
Governor, could I ask you?
I just want to ask Charlie one question myself that I think would be of interest to you guys. The sewing machines. How many different places have those sewing machines?
Those sewing machines, last year pre-COVID, we shipped to 87 countries.
There's a bunch, you guys are a very diversified company. So back to your question, Steve, they sell one of the primary products that they use to all kinds of other people, all right? So that's part of their income statement and part of their balance sheet. They also make a lot of other kinds of materials and gear for lots of other kinds of industries and enterprises that don't have anything to do with this issue associated with what they're doing here for us. And the other thing I would say, and I probably did a bad job of articulating it before, because they have been in this business for so long, and because they make one of the key products that's associated with delivering this, which is the sewing capacity, they're really smart about how to actually create the product itself. And when you start talking about that whole issue about being able to do the seal and 6 at once, I mean, that's got to change to some extent the cost of the actual cost of manufacture, which doesn't come out of the wages you're paying anybody. It just means you can do it a little faster than you might be able to do it if you use the traditional process. So I fully believe these guys will be playing in this space for a long time, and it's going to be a great thing. And the final thing I'll say, and this one's really important, I don't want to get too close to you because we're not wearing any masks. It's not just that the supply chains seize up when you end up in a situation like this. The price you pay for whatever you get out of that supply chain is extraordinarily high. And it's extraordinarily high, A, because of the scarcity associated with being able to access the product, but it's also high because the cost of getting it from wherever it is to here is enormous, okay? Now, the cost of getting a product from here to any place in Massachusetts is profoundly cheap, okay? But the cost right now of getting that kind of a product from anywhere else in the world to the U.S. and then to Massachusetts, very high. So, you know, there's a big net going on all the way through the manufacturing, the goods, and the transportation piece that I don't think you can underestimate when you think about what these folks are going to be able to do on a steady-state basis going forward and how that's going to work for people here.
Governor, could I ask you a question? You guys can swing. There was quite a lot of demonstration yesterday. I know that you have said you understand the anxiety that's out there.
Yep.
With small business people. Has it changed your mind at all, or what do you take away from what you saw?
Well, first of all, we've said since the beginning that we appreciate and understand that there are really significant trade-offs associated with the decisions that we've made. But we believe the most important decision was to do all we could to stop the spread, make sure the healthcare system didn't get overwhelmed, and do everything we possibly could to keep people safe and healthy, recognizing that that would come with significant economic dislocation. And I think at this point in time, as I said in my remarks, we are starting to see the positive downward trends in a number of those key indices that are so critical to our ability to actually pursue a phased-in reopening strategy here in Massachusetts. Now, they need to continue to go in that direction for a while to live up to the guidance that the federal government and many other countries have given to folks like us about how to think about this. But I think from my point of view, the most amazing part of all this is people understand and have communicated that they get the trade-offs, that they understand that slowing the spread, doing the distancing, sheltering in place, whatever you want to call it, losing an opportunity to work for some period of time is something that has to be part of the answer to how we actually get back to work in a safe and effective way. And I fully understand the trade-offs that are involved, but I've been really impressed with people's willingness to put up with that and to understand and recognize why we're doing what we're doing.
Are you concerned about the lack of masks out there?
We've seen a pretty steady drop in hospitalizations over 7 days. So are you talking another 7 days of a drop? That's 14 days. Are we on track to begin a phased-in reopening in another week?
Well, the reason we did the work we did to set up the advisory board in the first place, and they're going hard with almost every kind of employer group you can think of in Massachusetts on what people have learned from either their own experience in other places or their industry's experience in other places or their customers' experiences in other places to try to make sure that we have a pretty solid library of real-life experiences about what safe reopenings on a phased basis would look like. And like I said, I mean, we've seen for the first time a few days in a row of the right kinds of trends.
So is that what you need, though? Do you need the 14 days of this trend?
Oh, I think, no one thinks you need less than 14 days. Let's put it that way.
Did it trouble you to look out the window yesterday and see people standing so close together without masks?
Well, I've said this many times that the main reason you wear a mask, okay, is partially to protect yourself from others, but it's mostly to protect others from you. And I know that's kind of a hard concept when most of us think that that being sick usually comes with outward signs and symptoms. And for a lot of the people who end up dealing with COVID-19 and coronavirus, the outward signs and symptoms are brutal. But for a significant portion of the population that gets this virus and carries it and can in fact pass it on to others, there's a growing body of evidence that they're not going to show symptoms at all. They may not even ever know that they had it. And And part of the reason, one of the main reasons for the interest among government officials, public health experts, and business leaders, by the way, not just here in Massachusetts, but across the country and across the world, and having people wear some kind of face covering if they can't socially distance or physically distance themselves from others, is to protect others from them because of the high percentage of people who will get this virus, not know they have it, and be in a position to pass it, unfortunately, onto others who may be terribly affected by it. So I do believe people want to do the right thing on this, and I do hope that over time that they do, because it's not just about protecting yourself, it's also about protecting your friends and your family and your coworkers and sort of those around you.
Last question.
The legislative committee is suggesting recreational pot be open by appointment and to Massachusetts residents only. Is that something you would consider?
I think those folks are coming in to see the advisory board sometime soon. And look, I'm going to push a lot of the hypotheticals to the advisory board. The whole point behind, I'm going to have a lot to do with, obviously, wherever we land on this stuff. But I think it's important to have this forum for people who have been thinking about these questions and talking to others in their industries to have a chance to engage with a bunch of people who are either from their industry or know something about it or may know folks that are in it and certainly know a lot about the Commonwealth, to help us figure out how to factor that into the sort of rules of the game that'll be coming from our public health people. And as a general rule, I mean, I spend a lot of time talking to the Lieutenant Governor and to Secretary Keneally about the virtual meetings they've had so far, and these have been incredibly productive. I mean, we've learned a lot about not just what people think would make the most sense for them here in Massachusetts, but the real life experience that their companies or their contacts or their customers have had in other parts of the world with respect to a variety of strategies around keeping people safe. And I think that's where those conversations should take place. And I know that they're scheduled to come in, and that's exactly as it should be.
Before your nursing personnel yet or deaths, what can you tell us this evening about this and what's being done?
Well, we certainly have, as I think all of you know, a pretty big and significant program to do a variety of sort of both review, inquiry, and improvements and requirements with respect to infection control and PPE and managing COVID-positive populations, both among the workforce and among the residents across our nursing homes in Massachusetts. And we have been in touch with all the nursing homes in Massachusetts around this program, and people have been in touch with that one in particular for quite a while now.
Would you be okay with fines for people on state property at a big rally like that, not wearing masks, and that's your house, literally, the government's house?
Well, I think, first of all, I think most of those folks, I think, were like in the street and in the park. But I mean, my expectation is that people are gonna do this, and they're gonna do it because it's the right thing to do, not just for themselves, but for the people that they are close to. And I get the fact that getting to 100% compliance is probably not going to be a reasonable expectation, but I think people, for the most part, are going to do it. I really do.
Thanks, guys.